Ever wondered why chronic wounds take so long to heal? This isn't just idle curiosity, but a question that millions grapple with every day. Understanding the biology of chronic wounds is pivotal to grasp why they differ from regular wounds. Various factors, from age to health conditions, can transform a simple cut into a chronic concern. So, what makes these wounds so stubborn? To understand this, we first need to delve into what happens when a wound heals normally. When a wound occurs, the body immediately kicks into action to repair the damage. It's like a well-orchestrated symphony with 4 movements: hemostasis, inflammation, proliferation, and maturation. First, we have hemostasis. This is the body's quick response to stop the bleeding. Platelets clump together to form a clot, while blood vessels constrict to limit blood flow. Next, we move to inflammation. This is when our body's cleaning crew arrives. White blood cells rush to the wound, gobbling up bacteria and debris, preventing infection. Then comes proliferation, where the body starts rebuilding. New tissue, known as granulation tissue, forms. This is accompanied by the growth of new blood vessels to nourish the area. Finally, we reach maturation. This is the final stage where the wound closes up, the new tissue strengthens, and the wound contracts. Each stage plays a crucial role in protecting the body from infection and restoring tissue integrity. However, in chronic wounds, this process is disrupted. In chronic wounds, the normal healing process is thrown off balance. Various factors can cause a wound to become chronic, turning a simple scrape or cut into a long-term medical issue. For instance, conditions like diabetes can interfere with the body's healing mechanisms, leading to prolonged inflammation and delayed cell growth. Poor circulation is another culprit. It deprives the wound area of the oxygen and nutrients it needs to repair itself, leading to impaired tissue remodeling. This means the wound can't close up and heal as it should. Then, there's immune system dysfunction. An overactive or underactive immune system can disrupt the wound healing process, creating a cycle of damage and repair that leaves the wound stuck in a chronic state. So while the body is trying to heal, these factors are continuously undermining its efforts. Imagine trying to build a house while someone else is tearing it down. That's what it's like for your body dealing with a chronic wound. So, why do chronic wounds take so long to heal? We've learned that the normal wound healing process is a complex interplay of cellular and molecular events. But in chronic wounds, this process is disrupted. Factors such as persistent inflammation, bacterial colonization, and the patient's overall health can all play a part. Understanding the biology of chronic wounds can help us find better ways to treat them and improve quality of life for those affected.